Now, South Africa has received its first consignment of 2.8 million Pfizer COVID-19 vaccines donated by the U.S. government. A further 5.6 million doses are expected to arrive in the coming days. Now, for more on this, we're joined by the acting health minister, Mamuluku Kubai, to be a part of the conversation tonight. WhatsApp your questions and comments to 072-110-5584. You can tweet us tonight at Newzroom 405. Minister, good evening and thank you very much for your time tonight. Let's talk then about this. Give me some clarity. I think all in all, there will be 5.6 million that will be donated. You've received now 2.8 million. What does this gesture signifies and signals, particularly in the vaccine equity challenge that we have been seeing on the continent?
Good evening, Thabo. Good evening to your viewers. Indeed, the 2.8 that we received yesterday together with the Director General and the DM at the airport handed over by the representative of the U.S. government, who is the ambassador in the country, signals, one, response from countries from the issues, based on the issues that the President has been raising. You'd remember when he went to G20, part of what he raised as his part of his speech was around the vaccine equity, but access for developing countries, especially the African continent, where he raised concerns around that many of the developing countries are starting even to look at vaccinating children, while on the continent we are seeing less of economically active people, but also the most vulnerable groups not being vaccinated. And he called upon all the nations in the developed countries to say, can they come to the party? And as co-chairperson of the acquisition in terms of the what we call the vaccine track, in terms of the work that he's doing on the continent, and together with his envoy, Strive Misiwa, they've been going across the globe, negotiating, both in terms of access to be sold to the continent, but also in terms of making sure that vaccines are available. And that was a response from President Biden, who actually committed that he would be able to donate into the country. Initially, it was 1.8 as part of the work that has been done by the continent, COVAX facility as well. We ended up with 5.6 million, which is quite appreciated by the government of South Africa.
Absolutely appreciated by the government, and maybe appreciated also, shall I say, by many South Africans. However, Minister, I mean, ideally, if you get 5.6, at least 2.3 million people will be vaccinated, far away from the target that you have set for yourself of having 67% of the nation vaccinated. Talk to me then about how this will contribute largely to the vaccine target, but you also mentioned that it speaks of security of supply to meet the demand. So what is that current demand?
I think we need to remember this one is particularly a donation. But as a country, we have actually embarked on a program to acquire vaccines that we pay for as the country on behalf of its citizens. So the security of supply means that while we appreciate the donation, there's work that has been done in ensuring that the current approved vaccines are able to ensure that we are able to continue with our vaccine program. You'd know that we currently have J&J, we currently have Pfizer as part of our program, and we have publicly announced as government that any other available vaccines that are approved in the country, will consider them so that we ensure that we can roll out a vaccine program effectively. Now, when we talk about the numbers, you remember that the President announced that we're currently working on 31 million doses in the short term, but when we look towards the end of September and around October, we'll see more doses. So I don't want to talk to that because we do not have dates of delivery. As I said, and I always say, in terms of our program, we always want to talk about what we are seeing and what we are able to observe immediately.
Let's talk about that, what you're seeing. What is the demand currently, Minister, as far as people who are standing by, who are prepared to actually get vaccinated as compared to the supply that we have in the country?
Thabo, you'd remember that we've opened for the 60-plus population. We started with those. Then we opened for 50-plus population that we've gone to be able to vaccinate. And then we've also gone to vaccinate again 35 plus. You remember that we had initially announced the 15th of July as registration date, and then later we announced that we'll be able to vaccinate them from the 1st. But we've seen quite a number of them moving in terms of quickly starting to be vaccinated before even the 1st. Today is actually officially the day that we had set for the 35 plus population. When you look at that, on the 60 plus population, you're talking about around 5.5 million citizens. And then when you talk about the 50 plus, you're talking around 4.5. And then when you talk about the 35 plus population, you're talking around 12 million of population. When you talk about 18 plus population, it's around 17 million. So that's the numbers that we work on. And hence, when we look around in terms of the vaccination program, we put the numbers as well as the vaccine supply side to be able to say this is what we'll be able to do. And out of those population, Thabo, because we do know that there are people who are opting not to vaccinate, our target is to at least per population group to target 70% of it. Secondly, you would know that we've rolled out parallel to the same age group population vaccine rollout. We've also rolled out in terms of your sectors, your what we call productive sectors. So in the economy, we also rolled out in terms of frontline. In those categories as well, you're going to find the age group. So it's going to interface at some point, and that's why we are comfortable with the numbers that we have, with the vaccine that we've been able to start rolling out, and what we are receiving, that will be able to meet the demand.
Minister acting in the Ministry of Health tonight, Mameluku Kubai. To be a part of the conversation, do send us your questions, 072-110-5584. You can tweet us tonight at Newzroom 405. We'll continue with the Minister in a moment. Live with us tonight on In Focus, in conversation with the Acting Health Minister, Mameluku Kubai. You're part of the conversation tonight on WhatsApp as well as on Twitter. The number is 072-110-5584. We asked the question, how is this donation going to impact on our inoculation campaign here in the country? So, Minister, before we continue then with, of course, the rest of what the accelerated vaccination campaign is about, the question, of course, that is being asked, one, are the vaccines safe and effective, right? There's this notion that's going around that, no, these are vaccines that America doesn't want, so they're giving them to Africa. The second one is, are there strings attached to this donation?
Okay, the first one around the safety of the vaccine. From the assurance of the American government together with our interaction, and especially when we interacted with Strathmissile, who was one of the people who were vocal about it would be an indictment if America is to donate vaccines that they do not want or which are not safe. So we know definitely from the interaction and the assurance from the American government that they are not dumping the vaccines. These are vaccines which are still in good shape. The expiry actually is around November, which is long term in terms of the expiry from what we were given information on and the agreement. So there isn't, from where I'm sitting and the information that we have, no reason to doubt the genuinity and the honesty of the American government in terms of the donation. I think that's where we should be able to assure South Africans that from where we're sitting, there isn't any reason for us to doubt that this was not done in good faith.
Is there any reason to believe there will be pressure for favors or even potential concession? I mean, are there strings attached to this donation?
No, there are no strings attached. This is a donation that was given. It's not what we have gone to ask. We've asked for availability of vaccines so that we can buy. When the donation came, we appreciated it, and we continue to appreciate the gesture. So no strings attached, nothing that we have signed, nothing that we've been asked to do as a country.
Now, of course, access is great, Minister. The second part of it is an effective inoculation campaign, plus you've got to deal or reduce the level of vaccine hesitancy, which many have said, as far as the department is concerned, you need a more aggressive communication strategy, particularly around vaccines, to get people vaccinated. What are you committing to?
Look, one is for us, we continue to provide the information that we need to provide on the platforms that we are doing. Every week, we're providing more details around what has happened. You'd remember when we, previous week, not this week that we come from, we had a full discussion around the side effects, and followed by that, we did infographics that were able to be circulated on social media, on WhatsApp, for example, for people to know. We do believe that there is indeed continued anti-vaccine message by the anti-vaxxers. But we continue to say to them, they need to respect the rights of those who want to vaccine. You'd remember, Thabo, even with other illnesses, you'd remember the time of HIV and AIDS. People had a lot of stories around HIV, ARVs and all that, in terms of the myth that actually continued to happen, which led to a number of people actually dying, not wanting to take the medication. And our appeal to South Africans is that yes, we are saying this is not 100% proof. Like I always say, it's not Makona Zotle. It's a medication that is actually going to help you should you be COVID positive, in terms of not protecting you from being excessive or extensively sick or potentially dying. There are stories equally of people who are giving testimony. And my view is that those are genuine messages, authentic messages of people who have experienced the vaccine, saying, I am here, I've taken a vaccine. We as leaders have taken vaccines publicly. I've taken Pfizer. There were a lot of stories around Pfizer. My family has taken Pfizer, and no one has died in the family. So I'm still here. Quite a number of my colleagues who were in the category of 60 plus took their vaccine. They've already taken their second jabs. They are still here. No issue. Similarly, we continue to take. So I think the issue for us is to be able to try and encourage South Africans to say this is in the best interest of us ensuring that we can protect the nation. Right. We're doing this because, Thabo, you'd remember, should we have taken a decision as government to say we will not roll out? If you can remember the early stages as we were dealing with the pandemic, there was quite a lot of pressure from public to say, why are you folding your arms as government and not getting us the vaccines? Government has gotten the vaccines. Government has put it together a program where you have access to vaccinate as an individual, and it's your choice. We're not forcing people to, but we are saying make the right decision so that you can live and look after your own family and the loved one still needs you.
But there are a lot of questions, Minister, as you say, that around the transparency of those who are having adverse reaction to the vaccines. Yes, you're saying your family has taken, your family is well. Those stories we can see. But there are some families who are reporting having adverse reaction to the vaccines. Others even not dying because of the vaccines, but dying after having taken the vaccine. And as far as transparency of information is concerned, there are a little bit of glitches there as far as letting people know what actually is going on.
I don't think there isn't transparency. SAPRA has already announced that they are dealing with investigation of about 28 cases that have been referred to them. You'd remember those who are vaccinated will know. When you finish vaccination, you receive the first SMS that tells you about the side effects. The second SMS that says to you, if you have side effects or adverse effects, you need to report here. There's been quite a number of people that have actually contacted me with their families who have passed away. We've gone to investigate. We've sent the teams up front promptly to go and interact with the family, gather data. Once the investigations have come out and concluded, we will be able to publicly announce that. One, we will not say these are the people, the names of the people, but we'll generally give the reports, like we've done with the Sisonke program. You remember, Thabo, there was an issue about the inoculation of the healthcare workers, whether we are hiding information and all that. When that report came out, we had Professor Gray, who presented it publicly to say these are the findings, this is the information, and we continue to learn out of this. So I don't think there's a reason to doubt transparency from government. As we said, once the investigations are done, there will be. We just require people to report, because some of the people report on social media but do not log those into the system of government. But we do find even fake news where somebody would say, I know someone who has passed away, and they say the person has been vaccinated. When you go and check on the records, and this because we have to protect the patient's privacy, but also the privacy of the family. Unless if it's the family that says we want you publicly to announce that our loved one has passed away, never vaccinated. We are finding some people being associated with the vaccine who have passed away. You find that they've never been vaccinated. And it's an issue that it's a sensitive time for a family when they've lost somebody. And someone goes and writes on Twitter or social media or Facebook to say so-and-so has passed away because of COVID-19 vaccine. Now, as the minister, even if you know, or anyone in the health system, even if you know that it's not true, you can't go out because it should be seen as insensitive, because that family is dealing with the loss of a loved one, especially when it's not the family that says our loved one died because of COVID vaccine. So we find ourselves in those difficulties sometimes, Tom.
Right. And Minister, of course, there are questions and criticism around the Sinovac vaccine, which is now approved. Minister, are you actively procuring that vaccine to be available in the country?
What I can confirm, as I said on Friday, the process is that after the approval by SAPRA, we refer the matter to VMAC, which is the Ministerial Advisory Committee on Vaccine. I received on Thursday evening an advisory on the basis, actually they were looking both in terms of Sinovac and AstraZeneca. They have given us that recommendation. We will be able to take a meeting, the MEC tomorrow, which is Monday. I've requested a meeting with them to look at some of the issues I have as concerns, or even clarity in terms of what I see as the gaps, so that I can be clarified as the minister in terms of the advice. Following that, we'll take the matter into NCCC. Out of NCCC, we'll make public announcements.
Right. And Minister, let's talk then about this acceleration of the vaccination campaign. And you're saying that the 35s and below will now begin to register, but also you have that just above 35 cohort that is registering. You're looking at about 12 million plus the 4.5. Timely delivery of those vaccines, can we be guaranteed that they will be available at the time that that particular cohort goes and registers?
With current the 35 plus, which we are looking at this week, I can say based on the availability of information and the delivery of the vaccine, I am looking forward to a good week this week in terms of vaccination. We are not expecting any side to say they do not have the vaccine. We're hoping that in terms of the sourcing, especially including the private sector, they have been able to place their orders and they are ready. They will be able to vaccinate the population that are coming. because in terms of distribution, we have asked the team to ensure that we distribute the vaccine accordingly and ensure that sites do not run out of vaccine. So we are looking forward to the breadwinners joining us fully this week. And we are saying to most of them who are saying, I have registered, and many of them are saying, I'm waiting for a date. We are saying you don't have to wait for a date. You can self-schedule, either in terms of whatever site you want to go. Remember, you don't have to have a medical aid even to go to a private facility. So they have an obligation to vaccinate you, take the details. If you are an uninsured person, the state carries that cost, and we reimburse the private sector should you vaccinate at a private site. If you go to our sites as well, you register, you are able to vaccinate on those sites as either walk-in, or you could even be able to schedule a site. So we don't expect that people will say, I'm not yet vaccinated, I'm frustrated. Many of the sites, most of the sites, our mass sites as well in the urban areas are coming live. I'm going to Pixley, which is the district where I'm deployed, to also part of monitoring whether vaccination rollout is happening effectively in the rural communities.
Health Minister Mamuluku Kubai with us tonight, and we're going to your questions that you've sent through on WhatsApp 072-110-5584. So, Minister, let's tackle that first question then. The student teachers, some of whom are below the age of 35, excluded in the rollout. What's the thinking, what's the rationale behind that, especially with the schools now opening and even the grade ones getting back to school?
Chab, I'm not aware of that. What happened with the teachers program, we were given the categories by the Department of Education in terms of the educators in their schools, both in terms of those who are formally employed and those who are employed by SGB, together with the private schools, including the people who are assisting with what we call issues around providing meals for children. Everyone who's in the administration in education was part of the program. I'm not aware of any educators that were excluded from where I'm sitting. My understanding is that
if there are student teachers who are excluded, you're saying it would be incorrect that they be excluded. So they would need to then go
the decision. Remember, Thabo, our work in terms of sectors is led by the sector department. So they would know in terms of that. So I would advise that the person gets in touch with the provincial MEC to be able to clarify, but I will also take it up so that, because you might think that is one person, when I say it's a systems issue. There could be a reason if there are student educators who are still in school, if they are also teaching in our schools and they're interacting with children. My understanding is that they should be part of the vaccination program. So I'm not so sure what could have happened. We'll have to clarify that.
Right, let's take one more then coming through on WhatsApp tonight, particularly around the question of comorbidities. Minister, why are people with comorbidities not given priority? I'm a dialysis patient. I'm awaiting kidney transplant but don't qualify for vaccination. Am I not a high-risk patient? Naomi Kumalo in Ulundi. This is, of course, a question that is also being raised by health practitioners themselves to say, what is the thinking around the ministerial advisory team to say those with comorbidities, even when their ages are a little bit low, they would not be prioritized?
Look, Thabo, the issue when I got into the portfolio, I did ask about it because quite a number of South Africans were asking about it on social media and they would tag me. Now, part of what we got as feedback from the people who are running the sites, the vaccine sites, the practitioners themselves, were actually indicating that it would be practically impossible to be able to manage, one, from the scheduling point of view and registering, because it will require a lot of administrative work. Because what it means is that when you register, it means we must be able to say, upload the documents that proves that I have comorbidities. And you remember, they would differ from one point. So we were even having a conversation to say, do you exclude certain ones? For example, like you are making a case of a person with a kidney who is going through dialysis. Do we categorize those on a medical basis? Or do we say everybody, including those, for example, somebody who says, I've got diabetes, I've got sugar, I've got high blood. Do you include all of them? And what criteria do you use? And one of the things was that, for example, people were even making reference to say, I mean, you do find even in workplace where people have fake leave forms, leave certificates. Will we not get into that trap where we start having to spend a lot of time verifying the documents, verifying whether this person indeed has this comorbidity and all that. And that's why you can see the fast tracking of the age group, because it was felt that this is a particular area that can be able to assist us with everybody, fast track the age group, make sure that the vaccine is open, and then those who are willing to take it can be able to take it. And that we believe it's a good decision. We left with a month now. We will be starting with the 1st of September with the 18 plus. And remember what we said is that the 18 plus, it's not a registration on the 1st of September. You can register. We will open vaccination and registration on the same day. But we are requesting, because we do not want our sites to be centers of the spread or spreader events. So we're requesting that as you register, because you need to register on EVS, as you register on the 1st, you also book a session, because it will allow you to self-book so that we avoid, even if you walk, at least do a thing that is easier for you to do in terms of booking, because we are going to start monitoring in terms of the walk-ins. We might later have to stop the walk-ins and say, because we've opened the self-scheduling, people must schedule so that the sites are not a source of spread.
Pule Springs saying, Minister, it seems if you didn't get a jab, you carry a stigma where people say you are not welcomed at events, at malls, at places of work. What is government doing to eradicate this? That's Pule Springs.
Look, in terms of workplace, we've said that it shouldn't be. Remember, as we deal with the pandemic, there are quite a number of challenging environments and development in terms of policy. Those who are in the governance framework, those who are legal practitioners, especially the labor relation practitioners, will have to come in and say, how do they view? I don't want to be a general practitioner where I talk about everything. Our policy is that vaccine is voluntarily. We do not force people to take vaccine. Now, the challenge will be around the labor relations practitioners who have to work together with employers, will have to look at engaging Minister Nxesi to say, can they lead in the conversations and ensuring, because some of the employers are saying, if somebody does not want to take a vaccine, but they then want to stay at home and work away from home, when we've provided an opportunity, is that within fair? I can't answer that because I'm not a labor relation expert, nor a legal expert. So we'll definitely rely on some of the practitioners in various fields to guide us to say this is their input, because this is not just a health issue, it's a societal issue.
Now, Minister, I'm sure you get this question quite a lot because everyone is looking forward to the lifting of all these restrictions so that people can begin to participate in the economy but also attend big sporting events. This one is from Brian in Goodwood. He says, Minister, when is government planning to finish the vaccination process? And after that happens, will the lockdowns be lifted like in the US?
I think our target is to say, initially, the government has said by end of December. Initially, it was then February. But we believe that we can be able, if we are able to continue at the rate that we are continuing, surpass the 300,000 mark that the president has set for us per day vaccine, but also be able to implement the plans that we have. We will be able to earlier, because our target is to say when we come to the fourth wave, which the scientists are anticipating in December, that we would have a flat curve whereby we do not have high numbers rising. And out of that, then, as we said, NCCC will make a decision. I don't want to pronounce before that. I think based on the evidence that would be available before government, it will be upon government to make such a decision. So I don't want to jump the gun on that one. But I think what we are appealing is that indeed there are benefits we've seen in terms of global practice, that when people vaccinate in numbers and then therefore you reach herd immunity within communities, there are benefits out of that. What becomes benefits for South Africa, we'll be able to deal with it when we come to that, seeing how we perform, how the curve is in terms of when we hit the fourth wave and that will be a determining factor for us to be able to take those decisions.
Yeah. The donation of 500 million doses by the U.S. to the rest of the developing countries, including South Africa, is a gesture that is aimed at spurring the other G7 countries to do the same. However, there's a deeper conversation, Minister, around the transformation of this particular sector so that qualified producers from other countries like South Africa could be able to do this without the limitations of the waiver, the IP waivers that are there at this particular point. Let's talk then about the actions that are being actively taken at that level to ensure that those IP waivers are in place to increase global production of vaccines.
Yeah, Minister Patel has been leading in that regard from South African point of view. I think he would be best placed to be able to engage in detail in the work that they've been doing at WTO as part of the issues driving the waivers for vaccine accessibility.
Minister, we appreciate your time and thank you very much for joining us tonight. Acting Minister of Health, Mameluku Gobai, there with us tonight.